Welcome back to the Coffee with Crainer show. Today I have Kim Willis. She is the Director of Communications and Mental Health Promotion at the Canadian Mental Health Association here in Windsor-Essex. And today she's going to be providing some tips for young professionals on how they can improve their mental health and well-being. And this is such an important topic during this time, especially with this recent pandemic. So Kim, thank you for joining me on the show today.
It's a pleasure. Thank you for the invitation.
Absolutely. And each show I start off with a question relating to coffee. I have to ask, where close to you would be the best place or a place that you visit often to grab coffee?
Well, that would be almost daily, steeped tea from Tim Hortons. I don't even drink coffee. So, but I love the steeped tea at Tim Hortons. So I keep them in business with that, I think.
Yes, that's a classic. And it's a fan favorite, definitely in Canada.
Oh, really?
In Canada.
Good.
Yes.
But today I'm having chai tea, which I quite enjoy as well. So cheers.
Excellent. And for those watching, many may be curious what the Canadian Mental Health Association is. So for those that have not heard about it, would you be able to provide a little feedback or a little description about what it's all about?
Absolutely. So the Canadian Mental Health Association, our Windsor-Essex County branch, is the lead provider and advocate for community and addiction services. And we're also unique in that it's integrated with primary healthcare services. So we also have a health center right on site. So we're able to serve both the mental health needs of clients integrated with primary healthcare, which is really unique. We're the only branch in Ontario that offers that.
So has there been a switch during COVID-19? Are people still able to seek help from this organization?
Absolutely. So we offer over 20 programs and services, mainly geared to those dealing with moderate to severe mental illness. Like almost every organization, once COVID hit, we did have to take a step back and look at how we were delivering our services. So the primary healthcare side kept operating as they have been throughout the pandemic. And then on our mental health side, our caseworkers have been operating from their homes remotely. And instead of in-person consultations with clients, it's mainly been via telephone. We're slowly starting to reintroduce face-to-face visits when the phone just isn't cutting it. But we were deemed an essential service from the outset. So it's been busy. It's just been a new reality for all of us.
Yes. And have you noticed, specifically with young professionals, has there been an increase in the number of people that are seeking help?
You know what? I don't know that per se CMHA has seen an increase. Mm-hmm. I think it's been pretty consistent, but I do know that calls to the crisis center have increased significantly. And there's also a growing number of online platforms that we're able to offer to individuals and youth and young adults. So I would think, and based on my experience, is that those services have all seen an uptick in usage over these last couple of months.
Yes. Wow. That's such a great point.
Yeah. And like I've said to so many times over since March, that I think even the people that have the best mental health, this has been challenging for the best of us. And even more so if you're struggling with any kind of mental health issue and or addiction.
Yes, it is. And sometimes it's not always as perfect as it seems. If somebody does have that perfect lifestyle, correct? There's a lot of behind the scene things that do happen.
Yeah. And I mean, I think especially for young people, you can get trapped in the vortex of social media. And we know that what is presented on those platforms doesn't always mirror reality. And can be a slippery slope for all of us. But I think that would be one of my tips for all of us, but especially our younger population, is to make sure you're taking breaks from social media, because at the best of times that can be hard on our mental health and wellness, and even more so right now when we're more isolated and not seeing all of our friends and family as much as we have been able to previously.
Yes, that's so true. And I'd love to hear a little bit of what are some ways that young professionals can cope with stress, anxiety, depression, any type of mental health issue that they are faced with.
Right. Well, I think first and foremost is, if you are experiencing any kind of challenges, whether it has to do with stress, anxiety, or depression, is to find someone that you trust, that you can speak openly and honestly about. And then, based on what your personal situation is, you may want to seek some professional guidance or supports. And there's certainly more than ever available in Windsor and Essex County. I think one of the positive developments, if there is any, from COVID-19 is that we have introduced some new services. So in partnership with Hotel Dieu Grace Healthcare, we now have the Mental Health and Addictions Urgent Care Center located right on site at 1400 Windsor Avenue. So, this is mainly for people in a semi-emergency need, that instead of going to the hospital, which for a variety of reasons we don't want to go there right now these days, and even at the best of times, when you're experiencing a mental health crisis, the last place you want to be is in the emergency department. It's just not geared for those scenarios, ideally. So now with this new service in partnership with Hotel Dieu Grace Healthcare, we have a multidisciplinary team that's on site to deal with those scenarios. There's also the Transitional Stability Center on Ouellette, which again is a walk-in center if you're experiencing any sort of mental illness, including anxiety and depression. And what's nice in both of those places is that if that's not the appropriate service for you, then we're really dedicated to helping you find the service or program that you may need. If you don't feel like you need that intensive of care, then there's a myriad of online supports and phone lines that are available. So Family Services Windsor-Essex has a counseling line in operation, and that came about in partnership with the United Way as a response to COVID. At CMHA, we refer often to the Bounce Back program, Big White Wall, and then there's just been so many others that have popped up since the start of the pandemic. So, I mean, certainly that's one thing, is talking. We've really come a long way in addressing stigma over the last decade, but still talking. Like, there's no shame in experiencing stress, anxiety, depression. Everyone goes through it. And some of us just have better coping skills at given times. But I also think you have to look at self-care as well, and make sure you are taking care of yourself. And there's no better medicine than getting outside in nature and making sure you're getting some vitamin D on a daily basis, staying active, healthy eating, sleep hygiene. I think those are all really important things for balance and our mental health. And I know other people that swear by meditation, but it's really knowing yourself and what you're experiencing and what works for you. And we're all different, but there's certainly lots of tools in the toolbox. And also now more than ever, we have so many, there's so many webinars and online forums that are available. And I know at CMHA, we're offering them weekly, and then we post them on our YouTube page. And we're really trying to be responsive to all the demographics in the student.
Yes. So for many people my age, and I suspect other ages, there's a sense of you're nervous, you're scared to reach out. What are some ways of kind of taking that next step and finding help if you're too scared to do so?
Yeah, I think that speaks to, again, the stigma piece and just knowing you're not alone. In any given year, 1 in 5 Canadians experience a mental illness. And, we say now that there's no health without mental health. And I think increasingly we're realizing that and acknowledging it. And it actually gives me hope for younger generations. Because they have grown up in a climate where mental health has been more paramount than in previous generations. So I think that willingness to talk and seek help is more embedded in young adults. But that being said, I mean, I kudos to Linden, you and your generation, because things are tough, right? I mean, there's so much pressure on the younger generation and getting jobs, and then the whole university piece, and now like this pandemic. I mean, I didn't experience this in my 20s, so just so many things being thrown your way, and then the whole employment scenario now, right, is scary for all of us. So, but yeah, to my point, I think just confide in someone. And, like I said, it might be a friend, it might be a family member, but there's all these online supports too. And so it's basically, it's anonymous, and it's just being, it takes courage. And just, I encourage anyone to take that step, because it's all about perspective and, being able to move forward.
Yes. And let's say if there's somebody I notice at my school, or if there's somebody I walk by and I notice that there is that depression, or they are suffering from stress or anxiety, what should you do if you see that happen?
Well, you should definitely address it and talk to them about it. And I think that can be an uncomfortable situation, but in the long run, you're doing them such a huge favor. And sometimes you just have to ask the question head on. And I think in a lot of situations, the response to that is surprising, because I think people appreciate that someone has taken interest and the time and to address your concerns. And sometimes just talking it over with someone that cares is enough, right? That just getting it off your chest and saying what you're thinking and hearing their thoughts and such can provide such comfort. And in other cases, you may say, well, I think you should really go talk to a professional, or talk to your parents or a teacher or someone you trust. So definitely do not ignore it. If someone is thinking or threatening any kind of dangerous behaviors, don't minimize that. And just to look for the warning signs, because I heard too many stories where those warning signs aren't picked up on. And sadly, a lot of instances too where they are, and families have done everything they can to help their son or their daughter, and it hasn't ended well. So, I mean, just talk and address it, and do what you can to offer support.
Excellent. I hope those watching that really helped. And I think it's something important, like you said, is not saying anything is just as bad as, well, not saying anything, right? There's a huge negative effect that can have, and reaching out to somebody and talking to them and making sure that they're okay. I think for me, if somebody were to do that to me, I'd feel really loved and not alone, right?
Exactly. And that's one of our taglines actually in for September. It's Suicide Prevention Awareness Month, and we say that all throughout the month, that you are not alone.
And I wanted to talk briefly about We Connected, something that you're doing, and a hashtag trend that you're starting with Windsor-Essex. Tell me a little bit more about that.
Yeah, so Keep Connected came about at the outset of the COVID pandemic, because initially, if you'll recall, it was social distancing. We had to practice social distancing, and I think that was such a mistake from the outset, because never should we have been socially disconnected.
Mhm.
So I mean, I'm happy that now it's changed to physical distancing,
Yeah.
but we really wanted to encourage people now more than ever that you need to keep connected, that we are isolated, but there's still the phone. We have great technology now, that there's no reason for you to not keep connected with your family and your friends. And so using that hashtag, and we've been able to showcase over the last 3 months different ways that Windsorites and people in Windsor and Essex County have been able to keep connected. And it's been amazing at ways people have gone about that. So, I mean, we had one volunteer who took photos throughout the city, just, with the thank you messages to frontliners, and did this amazing video, and just the signs of support, and just the incredible acts of kindness and generosity, like the people, the restaurants that have dropped off food for our frontline workers, and done, made us masks when PPE was such a shortage. So it's been truly, truly amazing. And yeah, we just still continue to encourage people, keep connected, and it's so important for our mental health.
Awesome. Thank you, Kim. And those watching, I do encourage you to check out the Windsor-Essex.cmha.ca website. I had a chance to check it out a bit earlier, and there's a whole section on mental health. And if you want to talk a little bit briefly more about the website.
Yeah, so like Linden said, we have all of our resources on there, which lists all of our programs and services, information about the health center. There's information about our Soul Focus project campaign, which embodies all of our health education and training, which has grown significantly over the last 3 or 4 years, which is a great thing. And that will highlight all of the trainings and the educational sessions that we do. And there's also a tab right on the homepage that lists resources that are related to COVID. So we try to keep it as timely and update as we can, but certainly a lot of great tools and resources can be found there.
Awesome. Thank you. And those checking out, please check out that website. Definitely don't be shy and afraid to seek help. Kim, thank you for joining me on today's show. Absolute pleasure. I wish you all the best, and we'll see you next time on the Coffee with Crainer show.
Cheers.